This is a good question to start with, and I think this is one that I've heard as I've been reporting on this issue. People want to know, why is all of this happening now? Why all of a sudden all this about concussion? Even with modern medicine, and I believe we banged heads pretty good, I don't remember a lot of concussions when I played. So are we having more concussions? Is it just more attention to it? What is the deal? Mark, I'm kind of thinking of you, since you've been an athletic trainer for a while and in this field. What would you say to that?
I think concussions have always been there. Whether there's more now than there were before, I think maybe there's just more awareness now than there ever was. So I think it's still an underreported problem. You saw in the film, how many times have you seen stars, or has an athlete come off the field and the skies changed a little bit, or there's been a quick flash of black, and you just kind of shake the cobwebs out and you go back on the field. We were joking last night that there's been so many times where I've seen players come off the field and you start to walk towards them and you're going this way, and all of a sudden they start to go this way, and pretty soon you're playing hide and seek on the sideline because they don't want to come find me, and they're trying to stay away from me because they're afraid I'm going to pull them out of the game. And I think that's always been there. But I think the tools to recognize these things are getting better and better, and as awareness gets better, it's becoming more apparent that they've been there. It's just we're recognizing it better.
Do you think there's the possibility that there are a lot of folks out there who are suffering from it now? Maybe they played 20, 30 years ago, and that because there hasn't been the attention to this, they're not realizing that their symptoms could be related to some injuries that they suffered when they were in high school or playing college ball.
I think you can probably make that assumption, yeah. What the numbers are, I don't know. I couldn't tell you. But if you go back and look at the data you had back then, it's probably non-existent. It's going from here forward that we're really going to be able to find out down the road. And like Dr. Cantu said in the film, there's just not the amount of tissue out there to study, and the numbers that are, and the long-term numbers that are allowing us to draw really hard conclusions that are long-term, and we'll know this years down the road.
To dovetail on the back of that, Dee, you know, in my experience, I think for the most part the community is just, you know, that much more in tune with what's going on. They've actually been educated on it. There's a lot more awareness out there, obviously. And in my particular case, you know, when we were lobbying for the bill back in the legislature, one instance really sticks in my mind is I was sitting down with a legislator in there, and he was an old timer. He'd been there forever, and you know, he's telling me the story about you know his playing days, and I hear this all the time, and everybody likes to kind of rehash their old high school football glory. But you know, he's talking to me and telling me all these stories about, you know, he's knocked out here, he's knocked out there, he probably played with the concussion here or there. And anyway, I walked out of that meeting thinking, how are you even still alive? Because I couldn't believe just the brutal amount of trauma that this poor guy had been through. But nonetheless, you know, he's able to go on to a long and healthy and successful career. And anyways, you know, I think for the most part, it's you know, a lot of the awareness going on now is attributed to just simply a lot more people actually reporting their symptoms.
But I think I heard in the discussion that we had last night, someone mentioning that some brains are just different than other brains. Some maybe suffer more from this than others. Is that correct?
Jeb? Yeah, that was me. Yeah, we're all biologically different. And from my standpoint, being with a lot of my teammates through the years, everyone's concussions were different. One guy could get a concussion 20 times the same way and not affect him. Another guy could get it one time and his career would be over. So a lot of times, just the amount of hits or how you take them, you just never know. And so much of this, people take a concussion as just one thing, but I liken it to your knee, and you're not going to treat an ACL, PCL, or MCL all the same way. Same with your brain, understanding what area is affected and how to treat it that way.
Well, I'm going to backtrack just a little bit. Thank you for that. That was good. I think that after I watched this tonight, I had a heavy heart and kind of I'm a mom, you know, I have a 19-year-old son, loves to go at it. And so I think I need to hear from all of you just a quick statement about the balance, the perspective that you would like us to have as moms, as coaches, as athletic trainers, as athletes. After watching that, What is your reaction? And is it all doom and gloom? Or, you know, that was encouraging what you just said, Jeb, but I'd like to hear a little bit more from everybody down the line. Matt, let's just start with you and just a brief statement on down the line about it.
You know, when I first watched the movie, I had a similar reaction. You know, as an athlete, came away watching it thinking you know, it's in the books. I'm going to have CTE, and that's all there is to it. And of course, that isn't actually accurate. I think the most important thing walking out of this film for, you know, hopefully everybody is that, you know, they have the right perspective about this, and that sports provide so many opportunities, and we really don't know enough right now to have an accurate depiction of the entire picture. And until we have that, we can't really move forward in an objective manner to actually deal with this as a community. So, you know, hopefully throughout the education and everything that we're providing to the community, we can make some steps in that direction.
Dr. Nelson?
Well, in addition to that, I think there's obviously, you know, these themes are played up in the movie a little bit, where they discuss, quite frankly, the value of sport and keeping kids off the street and building camaraderie and having a team, and the value of hard work and discipline. And I think we all recognize that in sport, and I think that's critical and crucial. And the movie starts out with such a dramatic montage of people getting just horrendous traumatic brain injury that it's hard not to carry that through the entire rest of the movie. And that's the whole point of this panel discussion, is to try to talk about, well, what happened after that? You know, what does this all mean, and how do we interpret it? And I think it's important also to acknowledge the point that Dr. Cantu made, that the media play on this is up here and the knowledge is down here. And so because of that, we err on the conservative side, but we all feel like, yes, there's probably a way for people to return to their normal life, return to how they learn, return to their work, return to their play, and do that in a manner that's as safe as possible. And that's the goal that we're all shooting for here.
Bruce Newcomb.
Well, I think the question that comes to me is the gathering of the data and getting the facts and see how you're going to use that. From public policy point of view, you know, they constantly have the mantra that you need to have somebody of medical expertise at your team or at your school when you're playing these sports, and when in fact in rural Idaho, if you're in Declo, Idaho, or Castleford or someplace like that, having a sports trainer or somebody who could diagnose these instances accurately is probably not doable. But one of the conversations that Dr. Cherney and I had last night is we have the Idaho Education Network that came to be. It's now in the process of being built, so every community in Idaho will have internet access in their schools. Well, it seems to me that maybe we could expand that so that you could have experts on the other end somewhere that could actually look at some player that's been suspect to have a concussion, and have somebody somewhere in Boise, Idaho, looking to diagnose them and see if it's worth following up. So, but I do think it's important that we follow this through, because it's just like a lot of other things in our lives. You know, it's we don't know the time lapse between the injury and when it manifests itself. And the CTE can be, you know, fairly long time. Well, lots of people drop off the radar screen from the time they've been injured and when their sports life is over, and yet they still suffer with that disease.
Dr. Cherney.
Yeah.
I think first and foremost, it's important for everyone in our audience tonight to really understand that everybody up here on the panel really enjoys sports, and we're advocates for sports. So even though there's a lot of striking images in the film, none of us are ready to, you know, cut the gates and say we're done. And I think that's important, because in order to make this move forward, we have to not just cut things short and say, oh, well, we're just not going to do that anymore. It's impossible, because there is a huge gap between where the science is and where people's emotions come from. So that's kind of number one. Number two, from the standpoint of people who get concussions, and there's a lot of ways of defining that, and people kind of come with their own definition of what that is. The vast majority of people, the overwhelming majority of people, if they have a concussion, will recover just fine. And we're talking about the numbers, however you want to define them. Just fine and go back and be just fine. We're trying to put some emphasis and some understanding and some public perspective on what does it mean if this begins to happen, and to recognize the signs of these concussions, or recognize the signs of, did I maybe have something like that, and bring it to attention. If I take a look at what's come across my path in our practice over the last 20 years, I don't think that the number of severe concussions has gone up. So back to the first question. I don't think it's really gone up. As I take a look at our practice and what happens, I don't think that we're seeing more people with severe concussions. And that would be people who are people that get admitted to the hospital because they have such a bad injury that they can't go home. That is a significant minority of those patients. But if you kind of broaden that, and there we don't have, I'm not touting data and science here, but you would think that if everything was worse and there was a lot more concussions going on, there'd be some percentage of those that would also be severe enough to have to come into the hospital and maybe not be as good as they were before. So I think when we get into those sorts of things, I don't think we're really seeing more that reach that level of significance. What we are probably paying attention to and coming more to the public's eye is all the stuff that's been under the radar screen before that. And now these things are becoming a little more educational in the sense that what we thought were maybe not that, or maybe we should rethink that and begin to define those things.
Jeb, I was asking you when we both got done watching this if you had seen it before. This was the first time you saw it. You mentioned that. So I am very curious to see how, as an NFL player, you saw some pretty tough stories on the screen there. What is your reaction?
Yeah, I got choked up a few times. I remember last year when Junior Seau, Junior was a guy I knew that I played against a lot, and then had hung out down in San Diego together, actually, and really good guy. And I've seen a lot of this, and the scary thing is a lot of wives. Yeah, the NFL divorce rate's at 80% within 3 years when you're done playing. And I liken that to, or I tell a lot of the wives this, is that, if I get concussion here, well, I'm a different guy. I perceive things different. I understand things different. I react differently. But it was tough to see, because I know so many guys who are going through these problems in my age group. It's not so much the hits that everyone sees on Sundays, but when I'm on Wednesday, Thursday, Friday, OTAs, mini camps, training camp, two-a-days, it's daily. You're getting those hits. I usually ask a guy how many concussions they've had. They say 2 or 3, when they've been knocked out, and then I explain what a concussion is, and we get to the high hundreds to thousands, because it just, the reality of it, that's their job for so many years, and it just goes over and over.
Thank you, Nikki Clark.
Oh, wow, thanks. These guys all made very, very good points. In my work setting at the high school, I think it's important to explain to parents that it's that inherent risk is there. I mean, they have to sign the paperwork saying, I give my kid permission to play, and I understand that there's a risk of injury. And tonight we're focusing a lot on those head injuries, but it's the whole body. I mean, they can get a knee injury, an ankle injury, whatever. And so this falls obviously under that umbrella. And my goal in my job is just to explain to them that, look, I'm trying to get your kid to understand that when they're in a sport and they're getting all those redeeming values from it, the camaraderie, those are their brothers and their sisters, and they feel, the kids have a really strong emotional connection to that team. And the coaches foster that, and that's a good thing. And I was a member of team sports myself, and it is, that feeling runs very deep. But I want the parents and the kids to put that in perspective as well and say, look, I'm not gonna, my teammates and my coach they're not gonna stop loving me or caring about me because I need to take a couple days here and make sure that I'm healthy and that I'm okay. And when the younger brain, especially because it's going through development anyway, and when you put a big pause to that, potentially with a head injury, things have to reboot in a sense in a little different fashion than maybe an adult would. So I just want them to know that it's okay to come and tell me that you don't feel good, and it's okay to tell me that we need to take some time to figure out what's going on, and in the long run, it will make it a better experience for them, I think.
Mark Paul.
I thought it was kind of ironic when Matt asked me to be on this panel, and then I started looking at the schedule, and any of you that have kids out here understand that when your kids are involved in any extracurricular activities, you wish cloning was available, because you've got to be 6 places at once, and you're calling your wife on the cell phone as you're passing each other on the road. And my family was late getting here tonight because my daughter was at her soccer game, and they were talking about soccer here, and well, she had a basketball game earlier today, and my son's gearing up for baseball, and all of those sports, I've seen concussions over the course of my career, and here we are sitting up on this talking about concussions in athletics, and I was involved when Matt's career ended due to concussion, and I got to thinking, you know, it almost sounds hypocritical, I guess, on some level, that I go to work during the day and I have to sit down and talk to a kid who's done nothing but the right thing and say, sorry, man, it's done. And then I leave work and I get in my car and I go and I yell and scream and support my kids in playing probably the same sport that he got hurt in. So how do you draw that balance? And I think those benefits are there. I fully support my kids, and I'm going to encourage them till the day I die, as a parent should, and whatever they would choose to do. But like Keith Primo ended up, you can't live in fear of what might happen. There's risks in everything we do just by getting out of bed in the morning and going on with our life. And I think if you do what you can to make it as safe as you can, and the positives are going to far outweigh the negatives, and hopefully nothing bad does come your way.
Great, thank you for that. This next question has to do with the concussion law that's been in place now. We saw it play out through the football season this year, and it's brand new. This person wants to know, with that law in place in Idaho, is there any way to actually enforce it? Matt, let's start with you.
Yeah, we've actually gotten that question quite a bit, and the short answer is no. There is no formal enforcement mechanism in the law. But just like any, lost my words. No, we're good. But just like many things out there, if you're a youth sport organization, or if you're a school, you do have a duty of care to protect the kids under your charge. And so if you're ever held negligent, that's what I was searching for. If you're ever held negligent, I mean, you can be held negligent for any number of things. And so although there is no formal enforcement mechanism, people can still be held negligent, which you could also argue that, well, that was the case even before the law. But the one good thing about what the legislation does is everybody in the community now, at the very least, knows what's expected of them, knows what the bare minimum is to help protect our athletes, so that we can, hopefully do the proper education and the taking kids out when they need to be taken out, and hopefully providing them the medical resources that they need the most.
I'm not sure who would like to take this one, but I know baseline testing is something that we're hearing a lot about, and this person would like to know, is it a good idea to have baseline tests done? And if so, where are those tests conducted? What are the details on that? Dr. Nielsen, would you be able to address that?
Sure. That question sounds suspiciously like a plant to me.
Oh, well, maybe there is a name on it. I could.
So, yeah, so baseline testing, what is it? Well, I think we're talking about neurocognitive testing. So there's a lot of play in the media about different computer platforms for doing baseline neurocognitive testing. And the idea is to have whatever student athlete take a computerized test that takes somewhere between 20 and 35 minutes to do, that assesses several domains of executive function. And the idea then is that that's kept on file. If you have if you have a concussion, you can retake that test at some point and compare results. That is, you may be able to divine some cognitive dysfunction that happens that you can pick up on a computer-based test that you might not otherwise pick up. And so, for obvious reasons, if you have athletes who are minimizing symptoms and want to get back into play, but you have an objective piece of information that shows that they're cognitively not functioning at the level they once were, that says to you, well, maybe we need to rethink letting you go back in and put your brain at risk again. So that's the idea behind neurocognitive testing. I will say, as a provider who sees lots of athletes with concussions, it helps me tremendously in discussing concussion with that patient and his or her parents, or with that patient and his or her family. And so doing a baseline neurocognitive test is helpful. I would say it's been borne out in the medical literature over the last decade of research that we are more accurate at assessing impacts of concussion if we have neurocognitive testing and if we have vestibular testing and if we have symptom scales and interviews and a neurological exam all put together. Any one of those is insufficient. So I think to say you pass a test, you play, you fail a test, and you don't play, I think that's a little simplistic. But as a piece of the puzzle that we use to help assess patients, yeah, it's incredibly beneficial. The second part, where can you get that done? There are resources around for getting that done. We have been providing impact testing for a lot of local high schools and some junior highs. We're helping to do a monthly baseline testing session that we hold through the St. Luke's Concussion Clinic. And STARS, St. Al's Rehab Services, also offers some baseline testing options, which coincidentally are the same price as St. Luke's. So if you know, I want this to be sort of a non-denominational thing. This has blue and St. Luke's all over it, but in my mind, this is a community process. And I think what we need to think of first and foremost is what's right for the community. So whatever you do, if you can get a test done and then get a baseline done, I think it's helpful to have if you're going to engage in a collision or a high-risk sport.
Yeah, thank you.
I just wanted to say too, in the Boise School District, and this is a plug for my buddies in the back over there, we, the four of us, got together several years ago and started putting together some baseline testing for our own athletes in the Boise School District. And to echo what Dr. Nilsson says, you know, those are tools. And I get that a lot at the high school level, is if my kid passes A test, B test, C test, then great, they're good to go. And I just want to reinforce that those are tools we use to make a decision, that each person is different. That each person is different. And, you know, Johnny may react differently than Billy, and there's no explanation for that. Their tests are going to be different. Their recovery times may be different, and that we just have to keep our return to play consistent for each person, so that we can let them follow A, B, C, and D at their pace. And you know, we do standard assessment of concussion, balance error scoring system, and the impact testing in the Boise School District as baselines as well. And as much work as that is, it becomes very helpful to us to be able to take those athletes through that process and absolutely make sure with those tools that once we come to a conclusive decision that we've done everything we can to make sure that they're as close to normal as they were beforehand. So,
a lot of people want to know, I'm going to change the subject now, a lot of people want to know about helmets. And they're curious about the old helmets versus the new helmets, what's happening with research on helmets. Is there something we can do to make it safer through the use of protective gear? So let me just read a couple of these specifically. Can a helmet be custom fitted or made to increase protection effectively? And the other one is, are the new helmets too heavy? The old style were much lighter. Jeb, I saw you react to the question. What do you have to say? What do you know about that?
I actually brought one of my helmets. I forgot to bring it here. But you know, we did, when the company I was working for used this imaging to read the blood flow of the brain. And what we found was these areas were very easily concussed, and that's where most of the guys had their problems. And I liken that because our helmets, you can move it this way pretty easy. This part's pretty well done. But your brain is grape jelly, and the inside of your skull is really rigid, so it's very easy if you're kind of even barely stopped to get concussed. And when I'm 6'5", 250, and another guy's sprinting down the field at 6'5", 250, when you hit, there's only so much a helmet can do. It'll stop a fracture, but with your brain inside, it really doesn't. And a lot of these helmets, they're trying to do stuff, but I don't like them because I can't see out of them. They're trying to do too much with them, I think, but I don't know the answer to that, but I haven't seen it yet. I know they're doing a lot of work with it, and a lot of the helmet companies are getting sued, so they're doing a lot of work to help with them.
Mark, what's happened at BSU with that issue?
Well, we're fortunate that our head equipment manager is here in the audience tonight, Dale Holste, who is responsible for fitting the helmets and making sure everybody's in the right lid, as we call it. But it's great having somebody like Dale as a resource who deals with these different types of helmets that are always coming out and the newer models, and he goes to the conventions every year and sees what's coming up. And a lot of times we'll be evaluating a student athlete, and when we're done, Dale might pull us aside and go, hey, look at this, and he'll show us on the helmet, here's where he got hit, or look at this buckle broke, or in Matt's case even, the titanium face mask cracked after he got hit, right in the front of it. I'll never forget that. And so we can kind of put our heads together and say, okay, well, this is where he's complaining of pain or whatever, and Dale can show me the actual equipment. And I don't know that there's not a perfect helmet out there. If there was, we'd have everybody in it. You only can hope that the science will show that there's some improvements that they can make, and they make them fast.
I'm sure people would be looking forward to that. This real specific question, I'll just see if anybody would know the answer to it. What are the benefits of soft headgear in soccer? Anybody can speak to that?
I can give you the short answer. None reproducibly proven.
Excuse me?
There are none that are reproducibly proven. That is the benefits. There are no benefits that are reproducibly proven in studies that are methodologically rigorous, which is a fancy doctor way of saying doesn't seem to do much good.
Thank you.
Again, Bruce.
Yeah, it is.
A couple of questions real specific to concussions now. Let's try to get through these and just jump in if you can answer this. Can a concussion lead to a change in personality?
Yes.
Yes.
Quickly? I mean, does it happen? Sometimes can that happen overnight, or is it usually a long-term thing?
I've had teammates' wives go into a coach's office and yell at him because her husband couldn't find his way home from work, even though he had lived at that home for 8 years, had locked her and their 4 kids out of the house, and he might be one of the nicest people I've ever met, so I've seen him firsthand.
Mark?
Yeah, in our age group, they're a little bit younger. They probably haven't had the volume and the number of concussions, but we can tell the kids will come into the training room and there's just a different look in their eye. They kind of stare through you rather than at you, and it can definitely have an immediate impact.
Anybody else? Dr. Cherney?
So absolutely. You can see this in the emergency room immediately. You can see it on the field before they even leave. They're not acting right. They're more belligerent than they would normally be, and they're not just because their energy's all in the game. And it's not just because you told them they got to sit out a couple of plays. It can happen a day or two later. They are seemingly pretty okay, but then when you get them back into their typical home scenario around their friends and people that know them, it can be as subtle as they're just not the same. They're just different. And though those of us that see them short-term, evaluate them, and neurologically they look pretty good, carry on a good conversation with you, you get them back into their comfort zone of home and places, and we'll get a call a day or two later, things like that, says they're not the same. They're more aggravated, or noises make them a lot more sensitive. They're normally a pretty easygoing person, and they're belligerent now, and they're argumentative, and many, many subtle things come out when they get back, and that's something that can either be right away. It's pretty clear when it's right away, or it can absolutely be very soon after that when they go home.
What about recovery time from something like that? Do patients recover gradually, or is it sometimes a permanent change?
I think some of it goes back to some of the biological stuff that Jeb was talking about. Some of it depends on the severity of the injury. Again, the vast majority of people will have these things be transient problems. They will have transient changes in their behavior, transient problems with all the other things that go along with concussions, whether it's headaches or sleeplessness or problems with nausea and other kinds of balance problems. Some of them from seemingly fairly minor, where did it come from, that didn't look that bad, they can have things linger for days to weeks. They can have headaches that linger for days to weeks, and that gets into the whole harder definition where people say, gosh, you and he both look like they had about the same thing, how come you're so bad? And I think there is something to the individuality of people and the biology, and there's probably some of it that just because we thought it didn't look that bad Well, somewhere in the physiology of what happened that we don't understand yet, it really was very different. We just can't, as humans, visibly look at it and say, oh, it just looked the same, so therefore it must be the same. It clearly is not.
Jump in, Mark?
We used to try and classify concussions many years ago into different categories, and then based on those categories make an estimation as, well, it's this grade, and so that means they'll probably be out this long. As years go by, we've come to realize you just can't do that. You can't say it's a mild versus a major, or a grade 2 versus a grade 1, or any of those kinds of things. We just tell our coaches now, it's got a concussion. Well, how long are they out? Until I tell you otherwise. And that's really what you have to go on. It's hard for a coach or a parent or even the athlete to grasp that concept. It's like, well, I break a bone, it's 4 to 6 weeks. How come you just can't give me a number? Because you just can't. You have no idea how long it will be.
Yeah, very helpful. Thank you. Now, some folks want to know why all the discussion is about football, or at least predominantly about football. We did see other sports mentioned in head games. And then, you know, is one sport more dangerous, more likely to result in concussions? Somebody help us out here. Is it really a football problem, or is it across all sports? Matt?
No, I think, you know, you saw in the video, the movie, that, you know, it's obviously not just a football problem. I think, you know, football and given the culture surrounding it takes up a lot of headlines. You know, we are a very football-crazed society to a certain extent, which is a lot of fun, but at the same time it does have its drawbacks. And, you know, there's, you know, in Idaho we see the same type of statistics as along the national line, that you know, concussions are high in football, they're high in soccer, especially girls soccer. They're high, you know, in a lot of places. And another thing that I think we do need to keep in mind is that, you know, this isn't just an athletics-specific injury. I mean, you can get a concussion from slipping and falling on the ice. You can get them from motor vehicle accidents. And so this, you know, when I was talking earlier, kind of introducing everybody, I said, you know, in one way or another, this issue affects us all. You know, I really meant that in not even being, trying to be, you know, sport-specific with it.
Let me ask you this. This is kind of interesting, too. We've got some folks who have kids that play football, so they want to know, are some positions more dangerous than others? Another question, is head trauma more prevalent in more offensive or defensive football players?
Kickers, maybe.
I'm at a disadvantage. The speakers are out that direction, so just for me, Matt, what did you say? Oh, kickers, maybe. Okay, yeah.
Well, everything's different. When they did a study at North Carolina, and they looked at the G-force through the helmets, and, you know, if a safety was hitting a defenseless receiver, the G-force got up to, I think, 80 to 120, somewhere in that range. Well, O linemen and D linemen, or tight ends that were in there hitting all the time, it was repetitive, somewhere from 20 to 30 Gs over and over. So a lot of times it's not always those big hits, it's those little hits over and over that the guys are having the problems with.
All right. At what age should to start heading in soccer? And I think this raises maybe even a bigger question that a lot of folks would like to know after watching head games. What age should you allow your kids onto a field where this is a definite possibility? Do you have any thoughts on specific sports and specific ages? But let's try to answer this person's question about the heading in soccer and youth sports.
That's a very difficult question, obviously. So if you look at the epidemiology of concussion in soccer, it doesn't happen from heading the ball. It happens from playing the ball in the air and then somebody hitting you or hitting heads. Either that or you hit the goalpost. Those are the epidemiologic studies on people who get concussions playing soccer. What's the right time to start doing that? It's speculative. I think if we talk about myelination of the brain and when it's ready to start taking trauma, maybe Dr. Cherney could address that.
The brain's never ready to take trauma.
There we go.
I think somewhat the short answer is we really have no science to guide that yet. Again, it's that great set of questions that we would love to be able to answer, and we're far from reaching that science to understand that. We do know that the brains of our children and adolescents are continuing actually to develop all the way through their adolescence into their early 20s. How that is and whether that's completing the process and what all those things are still under some research investigation, but we clearly can understand through a variety of techniques that they're not really mature until that time. Now, some would argue that they regress in their teenage years and they're not mature till they're 25 or 30, but that's just how they act, not necessarily what the processes are going on in their brain. But despite that, I don't think we have any idea about what the impacts are on young children heading the ball or playing football with repetitive smaller hits or larger hits. The science really isn't there, and so if giving recommendations, I think we have to be honest and say if you went to see a certain provider who provided you what their guidance is, it's really going to be just that. You know, I don't think they would have any real science that they could stand on to say this has been shown to be this way. It's going to be their preferences. It's going to be based upon their experience with other patients in their practice. It's going to be their personal biases. And I think we all have those as practitioners. It's part of our duty to educate you of what we know and part of the things that what we don't know, but how we feel emotionally about it as well. But we really don't have the science to answer that question.
Jeb, how has your experience affected how you will deal with this as a parent?
Well, my son, I won't let him play football till he's in high school. I didn't start till then, so he can't. He can play every other sport, though. But it is tough, but I want him to be educated on it. And I think that's what's most important. And for a lot of people here, whether you're at Bogus Basin or playing softball Willow Lane or down at Bam Jam, if you get a concussion now, you know a little bit more about it and how to treat it and how to the understanding of it. And for my kid, I want him to be extremely educated on everything.
All right, thank you very much. You know, there's been some discussion here about different sports, but not lacrosse, and we do have some folks in the audience who have lacrosse players and want to know a little bit about how often they're seen, and apparently they don't wear helmets from one of our questions here, so is that an issue? Can anybody address that quickly?
Well, again, I think most lacrosse teams are wearing helmets, at least boys lacrosse that I know.
This says girls lacrosse in the Treasure Valley does not require helmets. Okay, require helmets. Why, and how can we change that?
I don't know the answer to the why.
But should they be wearing helmets?
Well, it's a biased answer, but I think that in terms of percentage of patients that we're seeing in the concussion clinic for referrals, we haven't seen a high percentage of lacrosse patients in the clinic. I think that, no pun intended, it's kind of a no-brainer that if you're playing a contact sport, that it's probably to your advantage to at least have some sort of protective gear on. Epidemiologically, again, speaking to that, as a percentage of injuries, lacrosse is one of the higher risk sports. It's up there with football and hockey and women's soccer, and lacrosse is one of those sports that potentially is high risk for concussion. So I think that the risk is there, and I think that you can get some protection from a helmet, as we discussed. A helmet really would have to be about the size of a beer cooler to decelerate your head if you're 250 pounds and running into somebody else who's 250 pounds, and so that's not practical. And I think the real way to prevent those concussive blows would be rule changes. So maybe there is a rule in soccer where you're not playing the ball in the air until you're 18, or maybe only on corner kicks or something like that. And I think that sort of institutional cultural change in how a game is played would likely reduce the incidence of concussion. But I do think that if it's my kid playing lacrosse, yeah, I probably would want them to wear a helmet.
Okay, thank you. I'm curious, Bruce Newcomb, since we have two Bruces right next to each other, do you think we need more laws to deal with this issue?
I'm not sure any more laws would help in that regard. I think the awareness factor, for example, the guard that had the concussion at Boise State that was so essential to the team, I admired Leon Rice when he was asked, well, when's he going to get to play? And he said, he's in the hands of the medical experts. When they say he's okay, he's going to get to play. There was a time where that wouldn't have been the case. So I think we're moving in the right direction in that regard. So I think the other side of that is I think I'm just listening to the baseline data that you can gather. If you could gather that on a statewide level, which I think is possible, where you did a baseline study of certain number of kids all across state that are participating in sports at the beginning of the season, and then have them take a same test at the end of the season, that might give you a baseline that's a lot more broader and deeper than what we currently have. So it seems like to me you could get a government grant somewhere on a state level or a federal level to perform that study.
Let's talk about that.
You heard it here. All right. Are there any plans for increased education for post-concussion syndrome? And in general, just this whole topic. I think you look at the folks that are here tonight, I would imagine some of you will go home and have discussions with folks. This event in itself is raising awareness, but what else is there, what else is in the works to increase education? Matt?
That's a very good question, Dee. Everybody's sitting in a room that has been the culmination of a lot of hard work, and to me, this speaks testament to what community leaders are willing to do and to help out this cause, and the new ways that we're attempting to interact with the community and really get everybody's input, because as noted by Dr. Nilsson earlier, this is a community problem. It should be treated as one. And I think, this somewhat ties into, what Bruce was just talking about. For me, I'm with Bruce. I'm not sure, any new laws would do us any good, but I would add to that, whenever there's a real positive change in our community and in our culture of our sports, it really comes behind the footsteps of small grassroots efforts of the communities that really get behind these and just start having a dialogue. At the very least, talking with people that run your local soccer leagues or what have you, and seeing what we can hopefully come up. Let me back up. I guess my hope is that we will be able to come up through this community dialogue with some innovative solutions going forward, rather than having to take, to me, the less preferable route of a legislative mandate to get this done. So with that said, I guess the long way of answering that question was that the short answer was, of course, we have plenty of new education opportunities that we're planning. We have, I've been blown away with the lacrosse groups that have actually started calling us, looking for resources. So we've seen a heightened engagement by community members, by schools, and all over the place. People just looking to talk, looking for a perspective, looking for resources, and looking for a better way of doing things so that hopefully we can preserve our athletics and all the opportunities that they provide.
And Matt, don't you go out and speak on this issue, right? Are you available to?
Yes,
to do
yes,
that?
I am fairly flexible. So if anybody, shoot my cards out in the lobby. If anybody has an interest in that, I'm happy to come out anytime.
I should mention just a little commercial here for ktvb.com. Matt and Christy Pardue were involved in a viewpoint program that we did a few weeks ago and provided some really, I thought, great information and perspective. It's online, and so you could watch that, and that might be helpful to you too. Enough of the commercials. Okay, without a brain scan, are there ways to find out if you have signs of ALS? And I was wondering as I watched it too, they were talking about tau, and they were looking at, the brain after a person is deceased. But again, the UCLA study that had just 5 NFL players that they were trying to see if they could figure out how to detect it before they're dead. Can somebody bring us up to date on the research there? And is there any way to know how much damage has already been done? Maybe Dr. Cherney and Jeb look like you.
Well, when I was working for a company called Sarascan, what they do is a SPECT scan, which they read the blood flow of the brain. And the way I understood it is there's nothing out there that can actually show the tau protein. But what they have been able to show now, and this is all newer technology, but it's like having water built up and there's a dam there, and you know the dam's there because of the water buildup, but you can't see it. So that's the only thing I know of.
Dr. Cherney, aware of anything along those lines?
Well, thankfully, there is a lot of research nationally being done on neurological disorders. Maybe not so much those in our pediatric and children population, but in the adult population. A lot of it has to do with the fact that our population is aging and our baby boomers are retiring and going to be in that age group. There's a lot of research dollars that have been devoted to that. There's a whole host of neurodegenerative diseases that occur as we age: Alzheimer's, ALS, multiple sclerosis, a variety of these things. Back to the question, is there a way to figure it out without a brain scan? In some of those, yes. Some of those have fairly characteristic exams when you see a specialist, such as a neurologist or a neurosurgeon, who can pick those up. The brain scan is the non-invasive way of doing it. A number of these neurodegenerative disorders create changes in the brain fluid, in what we call our cerebrospinal fluid, changes in proteins and a variety of things. And so you can detect some of them through a spinal tap and things. That's a more invasive way of doing it, so it'd be nice to find a way, either by a blood test that you could draw, or even better, non-invasive things. It'd really be nice to have non-invasive ways that you could definitively prove these things. So, though we're not there with the issues that were described here tonight in concussion, and we're a long way from that, but in some ways, the idea of how to detect that and what things to look for, there's other disease processes that are far ahead of that game, in the sense of trying to figure out what possibilities there are of ways to detect it. So maybe the time frame will be shortened, no way to tell, but there's already a lot of work being done on other neurodegenerative diseases that do occur, and what seems to be in higher numbers, and so there's a lot of research attention that way. So hopefully it'll narrow the window to create some issues here, but it's unknown at this time.
Okay, thank you. Are there effects different with back-to-back concussions compared to healing time between the first one and the second one? There's that question, and there's also this one too. If an 11-year-old has had one confirmed concussion, will it be easier for more to occur?
Basically, when we're looking at epidemiologic research on concussion, it can be very difficult to tease out the exact answer of this. And this is, so I'm waffling a little bit, is basically, that's again, going out of the doctor speak, I'm waffling. So, but basically what it looks like is, if you look at people who do epidemiologic research on concussion, there's no mandatory reporting system. There's a lot of different definitions of what a concussion is. And so it can be very difficult to determine, gosh, when did you have that first concussion before you had that second one? There does appear, however, to be some fairly solid research that would suggest that if you do sustain a second concussion prior to complete recovery from the first one, it could happen with a lower force trauma. It could have more protracted effects, and those effects could be more severe. So that says, okay, if the symptom window of this one concussion overlaps the second one, then yes, you could have a more severe concussion. What about if they're separated by a period of time? I think then you speak to, each concussion is unique. It's difficult to say anything concrete about that, except that there are a lot of studies out there that suggest people who report 3 or more concussions tend to have more problems than folks who have not had that many. So is that a magic number? Is 3 a magic number? I don't think 3 is a magic number, but I think that of the studies that are out there, it seems like most of the time when folks have had 3 or more concussions, they tend to have, they're many times more likely to have a 4th, 5th, or 6th concussion, and many times more likely to lose consciousness or have more severe symptoms with a subsequent concussion. So it seems to be those two issues, that you want to be completely recovered from concussion A before you subject yourself to risk for concussion B. And if you've had 3 or more, you tend to be at a pretty vulnerable group.
Well, you've got the microphone there. Let me just ask you this one too. I can just see this playing out across homes around the valley. When should a youth player be evaluated who has had a minor concussion, sleeps it off, seems okay, and wants to go back to play?
Well, our preference is that if they have an athletic trainer with whom they're working, or another medical professional who's trained in managing concussions, that they be evaluated whenever they're suspected of having a concussion.
Is there any such thing as a minor concussion?
Yeah, that's a good point. Yeah, it's like minor surgery is surgery on somebody else. A minor concussion is a concussion somebody else has. It's not your concussion. They're all pretty major. I mean, it just happens. They're major.
Well, now I get to ask a question because I've been wanting to ask this one, but don't worry, I'm not going to take too much time. But I want to know a little bit about the culture that surrounds all of this. And all of you come at this from a perspective that I think could answer to this. And that is, we watch these kids on head games play, and the coach is encouraging them to get in there and really go after it. And we take great pride, I think, as parents in seeing our kids have that tenacity, and they're hardworking, and all of those are great traits that we want our kids to learn. But doesn't it make it awfully hard then to now start really encouraging this new culture where concussion is taken seriously and acted upon by coaches, parents, athletic trainers? What kind of a friction is there in reality between those two forces? Mark?
Yeah, that's a good question. It goes back to, like I talked about earlier, I deal with their kids at work during the day, and then you go cheer on your kids at night in their sports. I think if I always tell a player who's hurt, if you can't go full speed, we're not going to go at all, because if you step on the field and you're playing tentative and you're worried about something, you will get hurt. Whether it's a concussion or something else, you probably will have something happen then. But just like any other injury, I tell them with the concussion, it's just an education thing. Let me know, so we'll know when to step in. For us, it goes back to really trying to know our athletes before they even get onto the field, so that we can recognize maybe if something is wrong and step in at the right time and make sure nothing further happens.
Don't you think parents have a tough time with that? And Nikki, I might ask you this. I think, our kids, we know they can be lazy sometimes. Sometimes they just are being lazy. How do you know the difference between being lazy and really having something that needs to be taken care of?
Well, that's a loaded question.
That's what I do.
Yeah, I know. Yeah, Mark talked about the advantage of being able to get to know your athletes before they even get on the field, and in the high school, we do have that, and I also am a teacher, and so I see lots of kids all the time, and for 3 years in a row in a lot of cases, and so I do get to know them pretty well, and it is nice to be able to see them and maybe be able to recognize that we need to step in and ask them how they're feeling. And there are those that you wonder at times why they're telling you the story they're telling you, but I think the important thing for us is that, again, we treat everybody the same way. If someone comes in and says, I'm not feeling very well, fine, you're not feeling very well, let's deal with it. But you because you know them so well, you do wonder, and you do have those different kids where they're in there every single day for whatever reason, to say hi or get some ice or whatever the case may be, and then there are those that treat you like the plague, and they want nothing to do with you, and don't come near me, don't talk to me, don't look at me ever. And then if they walk in and say something, then that's a big deal as well. So it's tough, but I think we have to really step back and look at the big picture and try to maintain our objectivity and treat everybody as equally as we can.
Jeb, we hear a lot, and we did in head games too, about that mentality in the NFL to just, keep going after it. Is that starting to change because of the awareness about this?
Some guys, I wish I would have had these guys as trainers in the NFL, because that's a different mentality even from the training staff, coaching staff, your teammates. You all have a goal to win a Super Bowl, and if you're dinged up and can't go, they'll find someone who can. And if there's a trainer who actually, really cares, they'll find a trainer who doesn't care. That's the reality of it. Myself being a late round pick, being a walk-on here at Boise State, I always had that mentality of I can't show that. I can't sit out a practice. I can't sit out a game because I'm going to lose everything I've been working towards. And now that there's a lot of lip service the NFL is saying out there, so until they actually start doing it, we'll see. The mentality is that warrior mentality, and it's just been around for so long. And if you want to play as long as you can, but if you start showing signs of weakness to your teammates or yourself, you're not going to make it very long in the NFL, and that's the reality of it.
Thank you. We have a few more medical questions, so I'm going to hit these real quick here. Are there any medications you can take besides over-the-counter to help with brain swelling? Or maybe it's not over-the-counter. OTCs? I'm not sure. I shouldn't try to be guessing what that is.
I'm actually not aware that there are any over-the-counter medicines that help with brain swelling.
Yeah, as I read the rest of the question, I thought that's probably not
true. And if there's a concern or a question or a thought that there is, as far as I know, there is not. So when we talk about pain relievers and anti-inflammatory agents and things like that that you would otherwise take for muscle injuries and joint injuries, your brain is neither of those. And those medicines, other than relieving headache, actually have no effect on brain swelling. So the only medications that you can get or even pretty much prescribe for any ideas of brain swelling are going to probably be things that you get in the hospital. There are some medications, but they're all by prescription that do seem to work for brain swelling. The vast majority of them don't really work in traumatic brain swelling. It's for brain swelling for other reasons, of which there are many ways your brain can swell based on the disease process. So we should not generalize ideas about here's a drug for brain swelling and it's good for all types of brain swelling. We won't get into that tonight, but basically the ideas of what we're talking about as far as traumatic brain swelling goes, those are medications you get in the hospital.
Also, please comment on sudden impact syndrome. How common is it? Either for Dr. Nilsson or Dr. Cherney, or both?
Which was it? I'm sorry?
Either one, or both, if you'd like to comment on that.
Second impact?
Oh, I'm sorry, sudden impact syndrome.
Sudden or second?
This one says...
Second impact.
You want to go first?
Sure. So, second impact syndrome, we were talking about whether or not this question would come up. So second impact syndrome has been described in medical literature as happening to somebody who has a concussion, a second concussion, before they've recovered from the first one. And the idea is that you have this loss of the control of the normal blood pressure in your brain, and your brain swells, and potentially you can die from it, or at least have severe neurologic sequelae from it. Again, because there's no reporting system that's mandatory, we don't exactly know how often this happens in the country, but it seems to be maybe 2 or 3 times a year that something like this happens in the United States. So second impact syndrome is sort of the most feared consequence of having a second concussion prior to recovering from the first, but it's something that I don't mention too often or don't put a lot of discussion time in on with my patients, because it's incredibly rare, and I don't want that to be the thing that they walk out with, that okay, I'm going to die if I get a second concussion, because that can lead to all sorts of paralyzing fears. I think the reality of it is that there are other much more common symptoms and sequelae that we understand much better than second impact syndrome, and then I'll let Bruce discuss this.
I think first up, again, just a sense of making sure everybody's on the same page. I tend to hold a fairly strict definition of what second impact syndrome is, and I think it speaks to what Dr. Nilsson just talked about. So second impact syndrome is not that you had a first concussion and that you didn't recover well enough, and then you got a more minor hit and you didn't feel right, and yet it really kind of set you off. That you just had a second concussion, you didn't wait long enough. Second impact syndrome is this really dangerous, really ugly, life-threatening problem that in fact does seem to happen, thankfully, really rarely, where the second concussion, and it can be more minor than the first injury, sets some mechanism off in the brain, and there's a lot of medical thinking about what that is, but where you get incredible swelling of the brain, dangerous malignant swelling of the brain that actually is very, very hard to control despite all the things that we have in the hospital to try to do that. And these athletes, or however this happens with the patients, many of them have died or become severely neurologically affected. So It is very rare to have that happen. It is really ugly when it happens. I have personally never had to see it or take care of a patient that has had it, but I'm very aware of it, and I hope that we actually never see it here in our community. It'd be great never to hear about it again, but we do see it periodically. It tends to be in our teenagers and young adults. I'm not aware that it's ever happened in people younger than that, in 5, 6, 8, or 10, not to say that it couldn't. So there are some changes and differences that are occurring. I don't think we can read into more than that as to what those age groups are, but it is not that you just had a second concussion. It is a very, very, I think, strict definition, discrete problem that is very, very problematic to manage medically.
This one, there's so many. I wish I could get to all of them, but this one, what are your thoughts regarding neck strengthening as a preventative measure for concussion? I would like to cite a Sports Illustrated article last fall regarding Syracuse University and their anecdotal evidence of neck strengthening, reducing the number of concussions. And I think that this one touches on this whole idea of prevention. Is there anything that can be done to help our young athletes, our athletes in general, prevent concussion?
One of the hypotheses out there about why females may have a higher risk of concussion is that they may have less developed neck musculature than males. And the physics of it are such that it takes a lot less force to deflect an 8-pound head than if your head is rigidly attached to a 150-pound body. It takes a lot more force to deflect that whole 158-pound apparatus. And so it may be that gosh, that can keep your brain from getting jarred so badly if you have stronger neck muscles and you're actually expecting the hit. I mean, you can have a neck like Jeb's and not expect a hit, and you'll still get a concussion. I think there's theory in it, and there's nothing wrong with the theory. I think that certainly if you're playing a sport that's a collision sport, it might help you. Can't hurt you.
Good point.
There's maybe some merit to it. And when we think about how to make prevention and make some of the sports safer, if we had discovered what the single event was or the single item of equipment or what the training piece would be, people would have probably gotten it and would have already been doing it. So there's going to be multiple factors, small baby steps that are going to improve this from from kind of all over the map. So neck strengthening, at least in theory, would potentially aid or help prevent, and again I'm talking about little steps, the idea that your brain would not be quite the same flip-flop back and forth that might occur not from the first hit, but what happens when you bounce, hit, and go again. So the neck strength is probably not going to change that first hit, because the force of that first hit is going to occur no matter what, but the neck strengthening may prevent some of that flop-flop, the bank and the bounce that might occur as you fall to the ground, hit, tumble, and things. And so there's some idea that the strengthening of the neck will prevent some of that additional sort of angular or gyral movements of your head and therefore your brain inside that would maybe reduce things. But it's not likely to change anything about that first smack that occurs.
All right, thank you so much. Well, I'd like to give you all a chance to just close us out with your final thoughts. Mark, let's start with you on the far end and take a few minutes and share with us something that you'd like us to leave with.
I think most importantly, just spread the word. If everybody was here tonight, just tell 2 people, whether it's parents of your kids' teammates or coworkers, people you work with in the clinic, fellow coaches in your conference, spread the word that it's not all doom and gloom. Concussions are a very real thing. There's no such thing as just getting your bell rung or just getting a ding or things like that, and they're okay, don't worry about it. And there's resources and people that can help you wade through this stuff. If you're in doubt, please ask. Whether it's Matt, whether it's myself, all our contact information's on the website, the Boise State website. Please feel free to call me, email me, whatever. But don't just push it aside and go, oh, back when I played. Because those days are long gone. And so spread the word, please, and utilize the resources that are out there in the community and try and spread the word.
Thank you, Nikki.
I guess the biggest, there's so much that we could encourage you guys to take away tonight, but I think for me it's try to keep, is at the high school level especially, try to keep it in perspective. You're playing a game, and it's important at that moment in time, and I get that, and we all get that. But you need to keep the bigger picture in mind as well. And I think that if you can take the time to do the right thing when you need to do it, in the long run, you're going to benefit more from it than if you, play tomorrow night versus waiting a week. There's no harm in that. And I know that seasons are only so long, and high school careers and your high school years are only so long, but there's some long-term consequence to keep in mind there. So think about the big picture.
Thank you. Jeb?
When parents always ask me what they can do with their kids to get them to be NFL players, I always tell them to have them be the smartest kids on the field. So for me, the educational process with this for parents, coaches, players, teachers, everyone, to understand what's going on and some of the signs of it, I think that's very important as they grow older.
Thank you. Dr. Cherney?
I would like to just really express my thanks to all of you for being here tonight. You guys have taken that first step. You've shown interest. You've shown that you want to learn more, hopefully have gained something from this, and as people have said, tell other folks. Use us as your resources. We're all very approachable. We're all very, available to you to try to add to things. Take this back to your community, and hopefully then we can, begin to do this in hopefully a groundswell process, or at least steady process, so that we can begin to, get our community educated. And we just really appreciate you coming tonight.
Bruce?
I would just say that things are changing. Matt got a bill through the legislature last year, so the legislature recognizes there's a problem here. There's Roger Goodell is saying, okay, let's have rules against helmet to helmet. Let's have rules against chop blocking, because that bothers knees. And now they're discussing whether let's get rid of the kickoff and maybe just have punts, so there's not such a ratchet up of acceleration of large bodies running down the field. So the discussion is out there, and people are becoming more aware, and your presence here tonight is evidence of that. And so I think as people become more aware, coaches will become more aware, and parents as well. My wife and I are cattle ranchers as well as everything else we do. And our youngest son, everybody has to be a cowboy in our family, but he had allergies, and it took us a long time to recognize that. And he was allergic to horses in particular. So he's now a captain in the Marine Corps, and so, but anyway, doing really well. So anyway, we as parents have to recognize that that our children are if they're in danger, we should not exacerbate that. If there's been an injury, we should support the athletic trainer and the medical professionals that know better than we. So I think this is a good discussion. And again, I'd like to thank you all for taking the time to show up, and because that's what life's all about, is showing up.
Mm-hmm. Thank you. Kurt?
I guess the message that I'd like to convey is if you feel energized, or you feel shocked, or you feel anything about the movie that you saw, and if you feel anything other than bored by this discussion that we're having, that you take that energy back to your community, and you find a way to make things happen in your group, in your community, in your soccer league, in your school. And that's how you approach treating this, because it is something that starts with just education and awareness.
And Matt?
I'll be quick with this, but just pulling from my experience as an athlete, I hope there's maybe a few athletes still in the room, and obviously there's some parents of athletes here. We've seen an overwhelming trend recently of athletes, prioritizing on one particular sport instead of really branching out and being involved in so many different areas. And when my career ended, you really had to, you were left in limbo, and you had to really search for an anchor about, where to, how to define yourself. And, really, you know, for me, I was newly married at the time, so I was obviously a husband. I was very active in school, so I had that. I loved being a scholar. Still am very active over at Boise State in finishing up my degree. You know, I love to read and I love to write. I love to hike. I love to fly fish. I love to hunt and do all of these other things. And I guess the one piece of advice that I'd like to give for at least athletes in here or even parents is to simply encourage your child to be involved in so many different areas, because I would warn you of someone, you know, just hyper focusing on one particular aspect of what life's all about, and then, you know, having the risk of having that just ripped out from under them. That can be pretty devastating. So I would definitely like to encourage that. And then lastly, I'd just like to thank you all once again for coming out. It means a lot to us, and it speaks, you know, volumes for hopefully the impact and the positive impact that we're having on the community. So with that, thank you very much.
Well, thank you.